All right. Welcome, everyone. Good to see you,
Welcome.
Melissa. Good to see you, Dave.
Hello.
Yeah, this is exciting. We don't normally get to meet like this and have
No.
the three of us, but we wanted to basically invite all of our grads to join this webinar. We're calling it the Unlocked, Next Level Unlocked webinar, which is kind of fun. But basically, this is a chance for all of you to ask us questions. We do have some questions that we've kind of collected that we can talk about. But we have had so much interest and so much excitement around this advanced course. It's the first one we've ever done. So before we kick off, why don't you guys say hello in the chat? Let us know who's here. And then Melissa and Dave, you want to start off and just kind of, speak your mind and let us know what you're thinking about next level. I know I'm excited. So
So, yeah, Dave. Hi, bud. How are you
Hi,
guys?
so good to see you. I see. Yeah, it's so funny. Like we run into each other in person every once in a while, and it's so nice to just jump on a Zoom and see everyone here. Um, this
yeah.
this project that we have launched in with this next level course, we've been talking about for years.
Mhm.
We've been trying to figure out how do we take this really exciting stuff that's like growing in the field, and like as the field of biofunctional therapy has grown and expand, like it doesn't fit into an introductory course because you have to have some experience to like take it and launch it. I'm so excited to see everybody come to Denver and actually try some of this stuff out that we have been using in our practices for the last couple of years.
Well,
Yeah.
yeah, I think, in the truth, what I'm so excited first, thank you everybody for joining and listening in tonight. But ideally, the truth is we're in an industry that's growing. It's changing. It's rapidly changing. I mean, that's one of the reasons why people love to take the continuing courses. They'll come back and they'll take, and we're so grateful to that. And I think Sarah is always the first one in the team is always to say like how honored they are that everybody comes back and does repeat courses. And we always say you should do it every 2-3 years at least because the material is always changing and it's evolving. But the conversation in the industry has grown as we all have, and I think, Dave, you were highly missed, but it was a nice confirmation in January when Sarah and I were both in Switzerland. Was there was multiple stages going on, and it didn't matter where you went in what room. There was a common theme that people were talking about: full body, central nervous system, going deeper, going beyond the tongue, and really thing. And these were all things that Sarah, myself, and Dave had been doing, had been practicing and playing around with because we had learned it in all these other courses. And then we would come to you guys on the discussion calls and on the teaching, and Sarah was like, "Okay, I'll put it here, I'll put it there." And Sarah, of course, you'll speak to this more. But then it felt like we would get those emails and we would sit with Jen and Molly and they'd be like, "Oh, you guys, it's going too deep," or like, we would joke and be like,
People are getting stressed out.
yeah, we're getting stressed out. I'm barely getting the first stuff." And it was always like, well, Sarah's always given us an opportunity to be so authentic and honest with you. When we are on those discussion calls, I mean, it's a podcast in a sense. We're talking to you what's really going on in those moments. And it was, we were trying to keep it very centered on the weeks, but there was always more. And so Dave would come into the conversation and was like, "Do we add more? We don't want to stress them with more courses." And ideally, this has been the opportunity where the three of us get to come together in a space that we know that you guys are all confident in your foundational stuff and you are choosing to explore new and additional concepts, and we can honor that without feeling like we're, doing something in a space that maybe you need to hone your foundational skills, and we don't want to be stressing you out. So I think, one, we're just both three of us, and tell me, I'm just excited to be able to present information and a technique and a style which I've had the privilege, and Sarah's, that we've been playing around with and utilizing at Faceology for the last 18 months, which has been a lot of work to quantify it and make sure it was something that was scalable and repeatable that everybody could, because Sarah has done such a great job in teaching in a manner that you guys can all walk away and implement the next day. I know, Dave, that was everyone, Sarah and Dave, it was like, okay, can they leave and utilize this on Monday?
Yeah,
And
yeah.
actually, I think that's one point that I want everyone to take away. Our goal is to give you guys something. It's an in-person course. So we can teach all day, all three of us, anything and put it on a screen, but we really want to emphasize that hands-on component. So it's everything you can't do online. That's what I'm really hoping for. So you guys can touch it, feel it, measure it, test things, role play, practice, I don't know, with products, practice having conversations, practice the new techniques. And also, when it's in person, you get the opportunity to network and hopefully make connections with other grads. I mean, that's one of my favorite parts of courses like this, where in the beginning we go around the room and everyone says where they're from and why they're there. And then people have these like amazing connections that they make, like, oh, I live there. I know someone there, oh, hey, we're right next to each other. And that, I think that's one of the most valuable things too, is just the network and community that you can build beyond. So
Well, I'm really
share my screen and just put up the official dates so that everybody has it. So, I don't want too much time to go by before we actually show that, but here we are. So it's called the Next Level course, which kind of captures everything we're talking about. We're trying to take myofunctional therapy to the next level. It's our first in-person advanced training experience, and it is May 15th through 16th. It's in Denver, Colorado. The QR code will take you to the website. All the detailed information is there. But I want to turn it back to you, Melissa and Dave, if there's anything you want to add before we start diving into some of these questions that I know a lot of people have. So,
Dave, I just wanted to give one thing. Sarah, I'm really grateful and glad that you brought up about the products. It has been no secret. I've been getting a lot of feedback. Melissa uses a ton of products. She's always using products. Well, how much could her kit possibly? I think I saw somebody. How much is she possibly charging for kits? And yeah, I have no shame in my product game. And I have really loved, and Sarah, Jen, everyone said we have every vendor that is attending is someone that Faceology, Dave, I know you have them too, but in Faceology, I can say almost every single kit goes out with now a MyoMunchie, a Spot Pal, a Sonu band, and when you graduate from Faceology, you get Replenish Straw. MyoBrace, I was with MyoBrace a long time. I sold those. So I've done a lot of cases with those. Okay,
no,
so every product I
use. In our kits.
No, but MyoBrace is too, and they have the great tools. But one of the things I just got off a call, I don't even know if Jen or anybody knows. So Spot Pal, anybody who goes through, they have like a little training program. They're going to you're going to be able to get your Spot Pal and have it at the advanced course, okay? So that when we're doing these screenings, I can actually show you how I use it with and without in and out during therapy. So if you get it, you'll be able to play with it right then and there. And I actually heard through the grapevine, they are doing a raffle for anybody who wants to attend the course. If you sign up, they have this little advanced thing. I'll get the direct things, but you will go into a raffle to get your tuition for this course comped 100%.
Wow. Okay.
Yes. So it will, I think it might be $299 or something to join their little certification program. But for anyone and their little certification program includes 3 Spot Pals, 1 for yourself, 2 for patients, which right there is like $700 or something. Plus you get their training on how to use it in their Sport Pal. But anyone that purchases that from now, I think it's the next month, we'll get the details. You will go to a raffle and they will then pick someone, because they are one of the platinum sponsors, to attend our course. You have to be new to Spot Pal to be eligible, I believe. Yes, Jennifer. Sorry, I just came off and I got a little excited. I was like, they're like, we're gonna comp a tuition. I was like, no,
that's amazing. That's so cool.
Isn't that cool?
Yeah. Dave, do you want to say anything before I want to just get to all the logistics and details?
Yeah.
Like where, what, all that, like just more details on the venue. But do you want to add anything to that? I don't want to cut you off.
There's a million things I want to say, and I'll keep it really, really short because I know everybody's doing. But like as we really developed this curriculum, we were really trying to think about like what makes a myofunctional therapist, what moves a myofunctional therapist from like an intro, like I'm a novice, like how do I move that needle into I'm handling some of these more advanced cases. And I think that we've really built this curriculum in a way that we can help you to move yourself from wherever you are to that next level. And that's really why we called it next level, is some of you will come in as like, and we know some of you have registered and you're like, I just finished the course, I'm brand new. We know we didn't build the course for that brand new person. We know some of you are going to come that way. We are going to be able to help you move from wherever your level is to that next level. If you're an experienced therapist and you've been seeing lots of cases, some of this stuff, I'm really excited to hear some of the things that Melissa and Sarah are teaching about because I'm ready to move myself to the next level. Because all of us are learning and growing. There's some really cool stuff. We're gonna do a little introduction to lymphatic drainage. We're gonna do some wound healing stuff, some intraoral massage. We're gonna touch a little bit on some of this TMD pain and like how do we help manage some of these TMJ cases when they come to see us that I'm really really excited about. And I've been working with my patients. We're gonna do it in we're calling this the scope safe way, where we're going to show you how to do it. I practice almost exclusively on telehealth, except for my new patients. And so like I'm doing it in a really scope safe way because I'm actually just doing it on myself and teaching them how to do it on themselves. So we're going to practice on each other though, there so that you can actually feel what does this feel like when I do
Yes.
an intraoral massage, when I stick my pinky in somebody's mouth and like what does that feel like as a patient? What does it feel like when I put that pressure on another person? So then when I'm actually doing this over telehealth, it's accessible and then the patient's actually doing it for themselves. So I'm really excited about a lot of this content that we're doing. But also one of the big things that we've been trying to figure out is like how do we manage burnout? And how do we manage a caseload so that, I mean, if you've listened to me talk about some of the things that I've got going on in my practice, it's really easy to get burned out. And we've seen
Yeah.
some really high profile folks in this field and around this field get really burned out and have some real serious challenges in their life. Like, how do we manage some of these things so that we can continue to treat patient day after day after day, year after year after year without frazzling ourselves to a point where we just don't want to do this anymore, or we end up with these other big serious life challenges. So it's this
Yeah.
combination of like we want to bring things to the next level, we want to move ourselves forward, we want to propel the field forward, and build a life that we actually really want to live.
Yeah, well, that's a great kind of segue because one of the main questions is like, what exactly like are we learning? And so I was going to have us go through and give a little
Yeah.
summary of what we're each talking about. Dave kind of did that already. So Melissa, I don't know if you want to go next, and then I can go last, and we'll just kind of touch on some of our main topics that we're all covering.
Yeah. So, one of the things I've been working a lot on is facial recognition, facial mapping, as well as voice tone and vibration. So, you guys hear me talk a lot about energy and sound and movement of how we're activating the entire body, and that we have kind of been working out on these phased concepts of therapy. So, my treatment planning has changed a lot. So, I'm going to be doing a full roadmap of how to treatment plan from the facial position, how you can look the face into thirds, and then have the voice confirm it, and then actually build your exercises based on the activation, integration, and foundational portion of it. So it's not changing what you're doing. It's a kind of an overall, like a little bit like leveling
Mhm.
up in a philosophy of being able to kind of make like meet patients where they're at instead of us trying
Yeah.
to fit a patient into maybe a more traditional approach, which still works fabulously.
Beyond the templates.
Yeah, beyond the templates. And it's really also, we're going to be diving into how I've been using AI to treatment map, how I've been using AI to treatment plan, how my notes have become night and day. And honestly, because of the communication leveling up and the clarity of the systems of how we're doing it, how we have seen an increase in the case acceptance, how we have seen
I
better.
want to learn the note stuff from you because
Yeah.
I'm still doing it like, manual and templates and just like not that advanced. So I'm
Yeah,
excited for
so
that.
the note templating, the treatment planning has been night and day, how to set up the different portions of that. And then also how our follow-up notes have now been very clear of like what their actionable items are and making sure they're doing it. We've also incorporated a new video check-in for the activation integration, which has become a really great philosophy that AI can actually track and put into notes. So I'm just going to go deep into how I'm using, technology to support a more advanced concept, as well as just different ways of looking at the whole body. And you will be able to walk away with templates and notes and all of that good stuff so you can go play away with it. We have the whole team working hard on it. Really just going deeper into pattern recognition. That's our big thing.
Yeah, and I love both of what you guys have said, because can you imagine, all of you listening, can you imagine if we tried to put that in the intro course, right? It would just, it's like, whew, it's overwhelming. It's too much when you're just trying to learn the basics on, like, as Melissa jokes, clicking your tongue.
Yeah, and I'm gonna
absorb all this other stuff, right?
we're even joking, like, is this gonna be too much for you in the advanced course? Like, so I mean, right, it's gonna be layers and layers, and it's right, there's never I think, Sarah, the number one thing, if I'm correct, when you guys go through the feedback and all that stuff, is that everybody wants to be they want to be ready. They want to be able to feel like they're confident in what they're offering, so that they don't have imposter syndrome, which, anyone that's everybody has it, so it's just part of the gig for a little while. But the more we can give you more tools and show you that there's a lot of resources out there. I mean, Dave, you've been a huge aspect of even us talking. And I think a lot of this also came from the business of course. I mean, us being able to present the business of MyoCourse had a lot to do with us showing how we were advancing our practices and how we were doing things, and Sarah, how we were meeting therapists in different places. And we wanted to also, share it with everybody, not just make it just a business thing, really make it a whole elevation of leveling up the whole concept.
Yeah. So I'll start out with, on the very first day, something that I think might be beneficial for everyone, where we're just going to really put a quick review of all the concepts that we already know about, but just to make sure everyone's super comfortable with that. So that'll, kind of ground us in the very beginning. Like, as we start off, before we get too advanced, we just want to review, like, let's go through the 5 pillars of tongue-tie identification in person. Let's go through TRMR. That's always something that, taking those measurements, people just want to get more comfortable with in person. So we'll spend some time the first day in the morning just laying a solid foundation in what you already know, you've already learned, but now we're going to, kind of do it like touch and feel. So we'll go over using bite blocks, the palatal flutter, swallowing assessments. We can kind of even play it by ear. I mean, if people are like, I want to get better at, I don't know, something specific, like, I don't know, taking photos with cheek retractors. If you're a speech pathologist, sometimes those are things that you're just not as comfortable with if you're from a non-dental background. So anything like that even kind of comes up on the fly, those are things we can talk about and try to work out. Tongue space assessments, are you guys comfortable doing the clinical evaluations around tongue space? And everything's going to be hands-on, working with partners, working with all of us in small groups. And there's going to be lots of time to learn on each other. So we'll probably partner up for a lot of things. I know Dave has some plans with role playing discussions and conversations. He's really good at that. And that's pretty fun. Then I'll be going over some of the, I've been taking deep dives into hormones and sleep, and how does that affect our body on a deeper level. So I have a bunch of research that I've referenced, and some of this oral systemic connection I'm going to touch on a bit. That kind of came from, I'm speaking at RDH Under One Roof, if anyone's going, that's a little plug. And that's my topic for that. So I've just been really deep diving into what do we get beneficially from deep sleep, stage 3, REM sleep, how's that affecting us on a bigger scale. We touch on it in the intro course, but this is definitely some advanced concepts. And then I have a segment on nasal hygiene I'm very excited about. We actually get to try out using the nasal rinsing techniques, the boom boom sticks, the X-Clear. We'll talk more about our nasal hygiene protocols and just, kind of let you guys figure it out. And we'll get to, I don't know, I guess talk about how do we use these with our patients, with each other. And I think it'll be pretty fun. I have some big ideas. And then I'm going to wrap it up at the end with bringing it together with some of the research and data we've collected from all of you with patient cases. And then just basically, where are all of you at in your careers, in your patient journeys? What are you struggling with? I've been collecting a ton of data, and thank you if you filled out any of our research information, because it's been fascinating to kind of see where you guys want to go, where you are, and just learning about, who's seeing patients and who's not, and who's seeing a ton of patients, which is pretty amazing, and how you guys are practicing. There's a lot more details, but that's the gist of it. So please put questions in the Q&A box, and I think we should switch over and start answering some of those questions. Are you guys good with that?
Yeah.
All All right, here we go. So, one of the questions that we got, and oh, by the way, let me just share this really quick. This is pricing directly from our website, but I know a lot of you are probably like, how much does this cost? Um, what what is the pricing structure? And Jennifer really, really wants you guys to know you can stack discounts, and there's lots of discount opportunities. So I'm going to read through that. But she's the one in charge of creating all that. She's our graduate support master, and so she's the one trying to get all these deals and discounts and special rates for all of you guys. So let me bring that up. Oops. There we go. So this is our current pricing. We do have early registration. I believe it's changing. For all of you, if you're watching this either as a recording or if you're here live today, just send Jennifer an email and say, hey, I listened to the webinar and I need an extra day or two. If you, I can't remember, Jennifer, you have to say in the chat, when does the early registration rate? And oh, there it is, April 1st. So technically it's tomorrow. We didn't want to like create that sense of urgency with you guys. But that's what's on the website. We're not going to change it, but if you do need a couple extra days or a week to think about it, and you're watching this right now, of course, just email us. We can extend it. It's not a big deal because, hey, you're all here and we think that's great. So let me, again, this is the pricing. Regular individual registration is $19.99. If you sign up with a partner, it's $17.99. And if you are early registration individual, it's $18.99. Let me go to Jennifer's notes because there are so many discounts. I want to read them all to you. I don't want to mess it up. So give me a second here. Jennifer's probably dying in the chat like, what are you doing? Okay, so early registration is $100 off. If you register with a partner, it's an additional $100 off. If you're MMT, it's an additional $100 off. And we have 2 interest-free payments available through April 15th. So did I get it right, Jennifer? Did I get all that? Also, it's really important for you guys to know, we're actually, and this has created a little bit of confusion, we're hosting this at the Vivos Center. And so if you've ever been there, you know that it's super convenient. It's very close to the airport. You can get a free airport shuttle. You don't need to rent a car. You don't need to pay for Ubers. The airports around there are all very inexpensive and they're big suites. And so I know some people have talked about like, oh, I want to find somebody and share a suite with because you can save money. And there was literally like 2-bedroom suites, 1-bedroom suites. It's pretty amazing and it's very, very affordable. Also, everyone talks about the food at Vivos, at the Vivos Center. It's chef prepared. There's so much food. So we provide breakfast and lunch and snacks. There's a cocktail hour on Friday, and trust me, you will not go hungry. There's a ton of food. I feel like I overeat when I go there. So, but just to clarify, this is not a Vivos course. We are renting the facility from Vivos because we like it, and we've been doing some joint courses with them. And they're like, hey, why don't you guys host your own course here? And basically, we're just paying them for the venue. So this next level course is just me, Melissa, and Dave. It is a Myo Mentor course. It has nothing to do with Vivos other than it's hosted at their location. And so that's one of the main questions that we've gotten that I'll just kind of reiterate right now is people are asking, what's the difference between the next level course and the hands-on Vivos Foundation and Function course that we've been doing? We did it in 2025 and now we're continuing to do it in 2026. So I don't know, Melissa or Dave, if you want to speak to that, but basically one's an intro and it's a follow-up to the 12-week course. And then the next level is completely different, advanced, and it's taught by us, not by Vivos.
Yeah, I'm just gonna say, yeah, I mean, me and Dave haven't been at the other courses at all. I mean, we haven't attended that one, and nor have we taught at that one. That is actually, and Sarah, you're there, but are we correct? You're not even.
I don't teach it. No,
yeah,
it's taught by the Vivos myofunctional therapists. Yeah. I'll be there. Jennifer will be there. But yeah, it's not actually taught by us. We're just partnered with them so that it's just an opportunity for new grads to go practice some hands-on learning. We know the Vivos people, they know us. And so it's just a way that we're trying to kind of work together to support all of you guys. So I know some of you may have been there already. This is totally different. You could go to both and you would get a completely different experience. So
I like to call this next level course the Seattle course because Melissa and Sarah snookered me into doing this with them by promising me we could do this in Seattle.
Yeah.
And all of a sudden, one day, I noticed that we are now doing it in Denver. So we'll call this the Seattle course in Denver.
Funny. I didn't realize that, Dave.
Right? Yeah, yeah.
Yeah.
Don't
Well,
worry,
and
Dave. You don't have to travel.
in all
We'll come to
fairness,
you.
Sarah, the Mile Mentor we did that. We switched it because we wanted to keep the cost
Yeah,
more effective for the students. And as much as Dave doesn't want to hear it, Seattle was a lot more expensive.
it's really, really freaking expensive here
Yeah.
in Seattle.
So
So-
that's the only reason it's not the
Yeah.
Seattle course.
Yeah. I'd actually love
Yeah.
to do it in Seattle, but it also is further for a lot of people.
Yeah.
And so, I was like, well, that's how we ended up in
Denver is
Denver.
in the middle. It makes it
It's in
so
the middle.
everybody could come to the middle. Yes, exactly.
Yeah, that's right. This
It
is the
doesn't matter.
Seattle
We don't
course
make a
in
trip. No
Denver.
matter where we went, somebody was gonna
Yeah.
have it. If it was up to me, I'd want it in Florida. So
There you go.
I mean, that would be a nice
I'd
place.
much rather be on the beach, to be honest.
Yeah.
And I will say, this is not like the beautiful Rocky Mountain part of Colorado. This is literally like the flat airport part of Colorado. So there's nothing else to do in that area other than just go to our course. So,
Well, and what's interesting though, Sarah, is like I'm flying in Thursday, like late Thursday night,
yeah,
and like we are together for all day Friday. We have the I can't remember, is the cocktail hour is Friday night.
yeah,
We're together. We're eating meals together. Like this is a walk-in here. So
Yeah.
if you're thinking, hey, I gotta go tour around a little bit, like you better book some time on Sunday because we are full in next level myofunctional therapy. Like we are having lunch together, we are having breakfast together. There's some
might have
restaurants
dinner.
if you want to go
Yeah.
get some dinner after the cocktail hour. Saturday night dinners on your own, but there's like I was looking at the map. So I'm bringing my daughter,
Yeah.
and I'm bringing a nanny to kind of be with my daughter for the couple of days because I'm like, there's no way she and I are hanging out together because we are locked in. So
We are locked in. I mean, it's pretty crazy. There's literally nothing to do. I think getting to downtown Denver is like a 30-minute drive. So you don't want to stay in downtown. That is too far. That would be silly. But if you really want to stay in like an upscale hotel, then you would have to stay there. That actually happened at I'm like, why are you guys downtown? They're like, oh, we want to stay in the Four Seasons. I'm like, that is not worth it.
Yeah.
It was a dentist and his team.
I know we were going back and forth, but we are going to try to be able to do some breath work. Are we trying to do that at Vivas?
Yeah.
Or
So,
we're going to try
in
to
the
do something.
schedule. Yeah,
I'll
let
do
me
some
read
energy
that.
healing for you guys. We'll do some movements. Don't worry. We'll meet you doing all kinds of good things. We'll keep
Yeah,
you
so
entertained.
on the second day, I believe, let me just find the morning of the second day, Melissa is going to do a whole body, what is it?
I'm doing it like
Maybe I'm reading the wrong
awareness,
thing.
yeah,
It's a
energy
breath
aspect.
work. That's the morning of, breathwork foundations beyond nasal breathing. Morning stretch and reset. That's what it is. So that'll be on Saturday morning where you'll, you can tell me what you're going to do.
Oh yeah, we'll just do we'll do a nice good morning meditation, breath, movement, do some energy clearing, do some energy work, be able to ground ourselves and get ourselves a little bit more.
And it's
centered in the
optional
body.
before everything starts
Yeah.
if you want to join Melissa for that. Okay, some of the questions here, I think we kind of covered this. Is there going to be time to talk with Sarah, Melissa, and Dave one-on-one? I think we're gonna have so much time to like hang out and get to know all of you guys. So, and then so people are saying like, what if I don't know anyone? Will I feel comfortable? If I'm not coming with a group, we had questions around that. I mean, I think so. We know you, you know us, or you know us. We will get to know you in person.
Well, I almost want to say, if you come by yourself, that makes the opportunity for you to get comfortable being uncomfortable so that you can meet new friends and create a new network of people and make yourself really feel what that energy is like. I'll tell you, I go on retreats by myself all the time, and it's actually some of the best growth I've ever had because I've met new people, I've created new experiences, new environments, and I've grown from it. And you'll do the same. So don't let that be a limiting factor.
Well, and what's really cool about this course is like the three of us are coming with three really unique backgrounds. And you're going to see the live version of Melissa and Sarah and Dave.
The live version of Melissa.
I've spent most of my adult life, I've spent bringing groups of people together. You guys know me as a myofunctional therapist. You know me as an instructor of myofunctional therapy. In my volunteer world, I work in the scouting movement, and I teach adult leader trainings and youth groups and bring teams of people together. I've been trained as a ropes course facilitator, and things like that. And so I think we're gonna be weaving a lot of this kind of skill set that Melissa has and Sarah has and I have at really trying to like figure out how do we get to know each other as
Yeah.
individual humans. And there's nothing more bonding than sitting down and learning how to do an extraoral and intraoral massage on
Or
on your
nasal
on your
hygiene.
neighbor.
Oh my gosh.
If you want to, it's challenge by choice. You don't have to do
You
that.
want to.
So
We got a lot of questions, and this is the last one that was kind of like a pre-requested one, and then I see we've got two in the Q&A box, and then I did want to try to keep it just to 30 minutes for everyone, so we won't see too much over. We got like, I don't know, many questions kind of around how do I know, is this going to be too advanced for me? How do I know if I'm ready? Let me see, like, what if I'm still early in my Myo journey? Like, how do I know if this course is right for me? That's what that like we get lots of variations of this. And my answer has kind of been, uh, you know, just for like, you have to ask yourself that. Like, we don't know if you're ready, but if you've only seen a couple of patients, but you're really craving like a little more knowledge, a little more hands-on, I don't think, ideally it would be great if you've seen a patient. I don't think it's a great course if you've never seen a patient. But I'll let you guys be the judge of that. You know yourself, you know what you're able to handle. But ideally, you've seen a patient at least, and if not more. But Melissa and Dave, what are you saying when people ask you guys this?
So
I'm kind of telling people to use their own
I'm going
judgment,
to start
but
with one first thing. If you're, I'm going to answer a couple of things. If you have not seen a patient yet, you probably should come so we could figure out why you haven't seen a patient yet. Okay,
good
because
point.
we can help support. Unless you have truly just like you're just in the current course or something, that's different. But if you're stagnant, we'd like to do it. But I will say the industry I don't want to use the word changing because changing it's just evolving. It's spreading its wings, right? So it's dipping into these different areas. And so I really do believe the knowledge will only inspire you and make your mind start thinking like your peripheral view, thinking a little bit more out of it. I there's never been a course that I've gone to. I mean, I've sat in many surgical
Oh yeah.
orthodontic courses. I've sat in courses that I couldn't even practice any of the things they were teaching me. And I have still walked out with a nugget, two nuggets that I was able to implement or change or modify. If you're sitting here and you're listening to us and you're curious and you're on the fence, there's probably some reason that you're intrigued. You want a little bit more. You need something that maybe is just holding you back. And so yeah, of course, it's in our best interest for all of you guys to attend. We want this to be full. And I do say this, and I just did a therapy Thursday makeup just a little, and I got a question. I'm going to share it. I'm just going to say it. It would be a lot easier for Dave, me, and Sarah to just do it online. I just want to state that. I don't mean this to be like, I'm not being
Yeah.
cheeky, but it somebody they said it like, well, you guys, it's in like as if it was in our best interest. Yeah, of course, if we want to fill the course, we want to fill the course for a couple reasons. One, we want to make sure you guys meet a lot of people and that you're feeling connected to it. But we have Sarah's proven it time and time. We can teach great courses right online, but we
Yeah.
knew we needed to meet. Dave was an advocate about it, and trust me,
Yeah.
nobody's spouse doesn't want Dave to leave more than Dave's. Okay, so when Dave's wife found out, and I promise you, when I see her, I'm gonna be like, it was his idea. I would have done another job. Okay. I only say that because it's not like, oh, Dave, Melissa, and Sarah were like, so anybody want to take a weekend? No, we wanted to create an opportunity that was different, unique. We knew you guys were
Mhm.
craving something, and that's why we're doing it, and that's why we're
Yeah.
making it. I
Yeah.
just
I
thought
mean,
that was important to say, and
no, that's so true. I
yeah,
mean, doing it online would be 1,000 times easier and cheaper and
yeah,
everything
yeah.
logistically it would be like, but that's not the point. We want to be able to provide that hands-on component that so many of you are craving, and we love connecting with all of you in person and connecting you with each other. So it's
Yeah.
really great.
and I think wherever you are, you are at a certain level. And our role really is to help you to get to whatever that next level for you is. If you've been practicing a really long time and like you think, hey, I am the master of myofunctional therapy, you're going to come to this course and you'll be like, oh my gosh, my mind is blown. And I have so many more things I want to learn. At the same time, I think we've really designed this course. I hope we've really designed this course in a way that you're going to walk out of here for Monday morning. Like, I have these things that I can do, but I'm not so overwhelmed with all this new information that I'm just paralyzed.
Yeah.
I've been to a lot of courses where I got to the end of the course and I'm like, okay, I've been in this thing for months. I've been working on this, and I'm so paralyzed. I don't even know where to start. And so we're going to wrap this thing up in a nice little bow when we get to the end of this of like, okay, what are our action items for where we're going to implement, and then how will I continue to learn and grow and progress and do this further. So
Yeah, no, that's great.
I think it's kind of a combo of both. Like, wherever you are, you're going to move forward, and at the same time, you're going to be a little bit overwhelmed, but also have some actionable items at the same time.
Yeah. All right, let's get to the three questions and then we'll wrap it up. So Elizabeth says, I forgot to book a hotel. Is there still a hotel block available? No, but the hotels are all so close. No matter where you stay, you can walk within like 5 or 10 minutes. So
Jennifer actually answered this question in the chat here.
Oh yeah, perfect.
Yeah, look on a map and you'll see
like, there's still a block available.
Everywhere.
There's still a block available.
Yeah, Jen says there is a block available.
Is it at the Hilton?
Hilton the other True. Yep, the Hilton True.
Yeah.
Hilton, sorry.
So there's still some at that, just not at the Staybridge. Ashley says, what's the attire? I think comfortable. I mean, you don't need to like dress up like, to the tens. Melissa and I and Dave, as speakers will probably be a little more dressed up than you guys, I'm assuming. But I think, jeans is fine. I don't know if it's going to be hot, cold.
To be honest, Saturday, I would actually say we probably can be a slightly more casual. Maybe Sunday is Fridays. We might be a little bit more dressed up on Friday, but Saturday, we're pretty hands-on and we're moving around.
Yeah,
so I don't think
it'd be like, don't worry about being super dressy.
Yeah, but you can rock your style.
Yeah.
Clothing is not optional. I told my assistant Michael that he asked me this question today, and I said clothing is not optional. That is the attire.
And then Tiffany, this will be the last question, and then I do have a little special discount code to share with you guys, and then we'll wrap it up. So Tiffany says, I'm taking a 7:55 out on Saturday night. Is that late enough? I think so. Like, last time I was there, I pushed it so tight. Like, the shuttle is like 5-10 minutes to the airport. The airport, it's pretty easy to navigate. It's not a tough one. And, depending on if you're checking bags, I don't think that would be, 7:55, I'd say leave at 5:55. That was me. I don't know how close all of you guys like to push it, but I'd probably leave at 5:50.
The only thing I would say right now, Denver can get a little busy at times.
Yeah,
so
I guess
5:55. You're fine.
I don't know what the TSA situation will be then, but even if you left at 5:30.
Yeah.
The course
we're wrapping up at 5:15. Our plan is to conclude at 5:15.
Yeah, we're not going to go long on Saturday, so I think you should be good. Anything else I need to cover, or me or Dave or Melissa need to cover, please let us know. But I think we're good to go, and I appreciate everybody who showed up. Thank you, Melissa and Dave, for joining me and helping answer all of the grads' questions. Jennifer says we did awesome, so I think that's it.
Awesome. Super excited.
Hey, thanks everybody for coming out tonight. Thanks for sharing your Tuesday night with us. I know some of you, this is late at night. I turn into a pumpkin at like 8:30, 9 o'clock at night. So I'm a West Coast guy. So
as you're seeing me yawning over here.
Yeah.
I know. All right. Thank you, everyone. Have a wonderful night, and we hope to see you at the Next Level course in Denver.
Yes.
Trails.